Good morning, everybody. It's Dr. J. I wanted to talk about estrogen dominance. It's something I see in my office a lot. We hear a lot of examples out in the community. We hear about the large number of hysterectomies, treatment for uterine fibroids, endometriosis, even breast and uterine cancer, ovarian cancer. These are all signs that our estrogen is out of balance in women. And unfortunately, when I see women, they're usually in their 40s or 50s or even older, and they've already had their uterus taken out or had ablation therapies, many other treatments that can take care of the symptoms but don't address the underlying cause. And that's what functional medicine is all about, right? Getting back to the underlying cause of the issue. So this is for those clients, but even more so, I think it's for those clients' daughters, right? Because a lot of the times our estrogen metabolism, and for women, when they enter menarche, when they first have their first cycle, and when they enter into menopause and their last cycles, that's really determined genetically. There are things that we can do to alter that, and that's epigenetics, and we can talk about that. And actually, even things that your daughters do early on can actually help your grandkids and great-great-grandkids, because that is kind of a genetic traits that we can alter somewhat over time and through generations. So what is estrogen dominance? Well, we're really talking about estrogen levels in relation to progesterone. And we want a good balance of them. When we kind of get out of whack one way or the other, we can run into symptoms. Most of the time, it's going to be estrogen dominant rather than progesterone dominant. And estrogen dominance leads to a rapid early breast development, larger breasts during menstrual cycles, tender swollen breast tissue, heavier periods, leading to fibroids and even endometriosis, which is where lining of the uterus leaks out through the fallopian tubes and actually gets into the pelvic area and causes inflammation and pain. These are all signs that the estrogen levels are too high. And that can be from either the ovaries making too much in relationship to the progesterone, or our body not detoxifying the estrogen and bring those levels down appropriately like they're supposed to. And I can work with you on all of those. We can work to kind of balance estrogen creation in the ovaries, not to suppress it, but just to give a little progesterone to kind of balance that. And we can work on estrogen detoxification. And estrogen detoxification is super important because that's that excess estrogen, or even the byproducts of estrogen metabolism in some women, will lead to a more toxic estrogen derivative than in other people. And some lifestyle changes, such as maintaining healthy weight, exercising, good sleeping, working on your stress, right? And a plant-based whole food diet with lots of phytoestrogens that we find in soy and other foods like that are super important. Also, getting a good digestive enzyme to help us break all of the amino acids and estrogen down, as well as healthy liver detoxification, as well as elimination. So having a bowel movement 1 to 2 times a day is so important. And I find that a lot of women with estrogen dominance have normal bowel movements, but maybe 3 or 4 a week rather than 1 or 2 a day. So that's kind of what we're looking for. And there's a reason for that I can explain in person, but we want to keep everything moving through the system and kind of eliminating our trash from our colon once or twice a day. So if you have signs of symptoms of estrogen dominance, or wondering if you do, on my website under the questionnaire tab along the top on the right hand side, you can take an estrogen balance questionnaire, and that will give you some ideas. Or if you've had those symptoms, or you've had any of those conditions, and or you want to talk about your daughter's future health, I'm happy to help you. So please give me a shout. All right, hope you have a great day, and I look forward to seeing you soon.